Hello everybody, my name is Maciej Mikolajczyk. I'm a happy dentist from Poland with a great experience with caries diagnostics and with DiagnoCam. I specialize actually in pediatric dentistry, although I run my own private dental clinic, so as in dental clinic, I tend to treat all kinds of patients. Years ago, I was one of the dentists that helped introduce DiagnoCam in Poland. Since then, I am working with the DiagnoCam device, and I found it as a very, very useful device in my dental office. Actually, a couple years ago, I was organizing my new dental clinic, and the whole concept of diagnosis I built around DiagnoCam device. So now I would like to share my experience on that topic. One more remark. Probably you will have some questions during the webinar. Hopefully some of them will be answered later in the webinar. But please remember all of them, write them maybe in a chat or somewhere on the piece of paper, and we will open the discussion after the presentation. So I have plenty of time. The whole day is actually for you. If only you have some time, we can discuss all the questions that you would like to ask. No problems. But I know from the experience that it is more convenient to make it after webinar because some of them usually are already answered. Okay, so now let's start. We see the topic effective caries diagnostics in children and adults, of course. So when we think of caries diagnosis, we actually see two challenges. This is a very short introduction. We need a clinical perfection of caries diagnosis. So we as a dentist need to know that our diagnosis is right and that is 100% sure all the time. But we also need another thing. We as a dentist tend to focus on the clinical perfection, not always remembering that equally important is the ability to inform the patient about the diagnosis and build up patient motivation for the treatment and prophylaxis. So this is also part of the caries diagnosis, how to explain it to the patient, how to inform the patient about it. Is there a perfect method for caries diagnosis? Of course there is. What we can use in our dental office, or what did you use so far? Optical examination with the use of our own eyes, maybe bite-wing X-rays, and now you will use a DiagnoCam device with near transluminescence. So, of course, thinking of caries diagnosis, on one hand, we can think of a patient like this, when there is absolutely no problem with caries diagnosis at all. But such patients are actually, at least in Poland, becoming more and more rare. Most often, I see patients like this, patients with pretty good teeth, that tend to have some level of hygiene and some level of conscience about the teeth, but still experiencing some problems with the caries or with the cavities. The cavities that are not visible at the first glance, also not visible to patients, but the patients are still feeling some problems, experiencing some problems with the teeth, and they still expect a perfect caries diagnosis from us. So with visual diagnosis, we can use our eyes, we can use a dental probe, and such a examination that we tend to use every day for like hundreds of years probably now. It is for sure painless and non-invasive, although we couldn't say it is comfortable because we need to sometimes touch the tooth, we need to use some air, maybe some water and so on. We get no documentation out of such examination. By documentation, I mean the view of the tooth with the caries visible, no matter where it is located. But also, this is the type of examination that leaves us as dentists as the only person 100% to decide. And sometimes the decision is not so easy, especially if we see at the images of ICDAC 2 or 5. It's not always clear, maybe 3 also. Not always clear, should we drill or not? How does it look? Also, it works only for class 1 cavities. X-ray radiography is something that we use when we tend to look for class 2 cavities in the proximal or distal region, because otherwise it is not working well. For sure, it's painless. We get the documentation, but it is actually, we must remember it, invasive examination. We have radiology, we have some radiation that our patient is exposed to, and it is not safe for the patient, especially if the X-rays are repeated. And nowadays, like tomographies are actually repeated quite often with our patients, also due to some medical problems. So the dose, whereas it is small with one X-ray, dental X-ray, but patient can experience a lot of radiation because of some other medical problems. Also, it is quite difficult with bite-wing radiography, because to make sure that we check everything, we need like 8 different images, which is really a lot for the patient. We could think of pantomography, but we know pantomography is most time useless when we think of the interproximal area of teeth, because of the overlapping of the teeth and also some changes in patient position. None of this is 100% foolproof to allows us to say. Also, we must remember that radiography is good at the when we can see the actual physical damage to the enamel. It works mainly for the enamel at the interproximal areas, but it is not so easy to observe demineralization. So that's why laser caries diagnostics comes in a way to save us from all our doubts about caries diagnosis. And DiagnoCam is actually right now the only device that will allow us to use such a method of caries diagnosis. It is painless, it is completely non-invasive, and finally we get the documentation that we can easily present to the patient, and patient will understand what she or he can see on the screen. Also, for us, we get the documentation that the caries actually is there. So in my opinion, and that is what I am using in my dental office, this is right now, from all of the choices, the best solution for caries diagnosis. And this is how I explain it to my patients. We get the DiagnoCam Vision device, which actually is 3 devices in one, and it makes perfect sense, which you will see afterwards. We have the built-in intraoral normal camera. We have the diagnostic laser device for transillumination and the fluorescent lamp. So this is like a perfect combination for me in my clinical work. From time to time, you will meet patients that will be expecting some more information from you. It's not very often, not very common, but usually it's a male patient, usually with some technical background or technical knowledge that are asking some more questions. So this is the knowledge for such patients. DiagnoCam is a device that for the method of work, we can explain it as near D40. Near is for near infrared, which is the wavelength that the device is working during transluminal illumination. DI is for digital imaging, which is quite obvious, and 40 is for fiber optic transilluminescence. Again, I think this is the method. For a really tough patients, believe me, you will meet some. The wavelength of the light that DiagnoCam is working on is 850 nanometers. So this is a so-called near infrared wavelength. It's out of our visible wavelengths, so we cannot see this kind of light, but it is there. It requires a special camera that is built in DiagnoCam to see that image. Also, all the time, I will be referring to the DiagnoCam as to the laser device, because it is actually diode laser device, a very weak diode laser device, in the same way as a laser pointer is diode laser device. So because of some, let's say, marketing reasons, laser is a very magic word in our dental office, and it always sounds right. So remember the wavelength when you get a professor of physics on your dental chair. How it works? The idea is very simple. We need to get the beam of the diode laser through the fiber optics that will be located and will be placed around dental alveolar bone. Such a wavelength, near infrared, is going through all the tissue in our organism. It is going through the gingiva, through the bone, through the tooth tissue. The camera is located here at the vertical point, and it can observe how this infrared light reacts with the tissue. With the enamel, we can see the transition. With the dentin, just some scattering. With the caries, this wavelength is blocked. The same technique is used in cardiology as a laser Doppler flowmetry to check the blood flow, also sometimes in dentistry. So we get the view of the tooth from the, let's say, as we look at it from the up, and we see the enamel that the infrared light is going through. So this is the lightest part of the tooth. Then we see dentin, where the light is scattered a little bit, so it is a little bit more dark. And we see some more dark spots that the light is blocked, and this is caries that we can see around here. So this is how normally it works. And this is the images that we will see when we will try to examine every tooth. Those three different effects. The image from the transillumination mode, as you can see, is black and white, because this is also infrared camera, which actually is good because it resembles more or of an X-ray image than a normal one. So also for the professors of science in your head, I give you some scientific information and research, so you as a users can be 100% sure that DiagnoCam is working very well. It is the best method of caries diagnosis, and you can use it safely. Of course, you will see it with your own eyes while using it, but anyway, it has been tested. According to class 2 cavities and non-cavitated approximal caries, DiagnoCam has better sensitivity, specificity than bite-wing X-rays, and much better. Also, cavity shape is much better explained and visible. So this is better than bite-wing X-ray, not only because it's non-invasive, but also because it's so better in diagnostics. When thinking of visual examination and class 1 cavities, again, we get better results. So, of course, there is never 100% accuracy, but this is as good as we can get when we think of dental treatment. Okay, so just to finish it, what are keywords for the patient that you should use when explaining at the beginning? We will use laser device to look through the tooth and search for the caries. Laser is a magic word. It will be like an X-ray because it will be also black and white, only without any radiation. So it's better than X-ray. Instead, we will use a laser, so it's better and safer. Also, when I tell it's like an X-ray, it means that probably I will expect my patient to pay for such an examination, as it is normal that we pay for an X-rays. We will make some pictures like with an X-ray, but we will use small laser instead. And for those who are very nervous, the laser beam is very weak. It will be completely painless and harmless. You know, laser is also connected with some sci-fi movies where usually it is a very destructional device. So we need to say that it's very weak. It's harmless for everybody. Okay, so coming to DiagnoCam Vision. We can use it as a caries diagnostic device with the near D40 and with the transillumination. And this is what I will focus mostly on, because this is, in my opinion, the most interesting part. But remember, we can use it also as a standalone intraoral camera, just for the as a documentation device, even for the cases when we don't plan to diagnose any caries. Also, we get the fluorescence device. Please remember about it. It will be very useful for children patient when we think of it as a documentation device. So how to start to work with DiagnoCam? First of all, we must take into consideration hygienic precautions. DiagnoCam is the device that will come in contact with the fluids in the mouth of the patient. So we should cover it with a plastic sheath. This plastic bag has actually two different sides. As you can see, one is not transparent and another one from the inside is actually transparent. So we always need to put DiagnoCam inside in the same manner. If you can see KaVo logo on DiagnoCam and on the plastic paper, then you know you put it in a good way inside. So please always do this like this. It's the easiest way. Remember to get rid of some air from the round camera place, and that's it. After putting it in, you can mount a trans illumination tip on the DiagnoCam. Trans-illumination tip you can put into the autoclave. It is autoclavable, so it can be autoclavable between patient. The DiagnoCam, of course, is not, hence the plastic sheet. Both for the trans-illumination tip and for the DiagnoCam, you can also use some mild disinfectant to locally disinfect it as well. Okay, so after you prepare the DiagnoCam device, then you prepare the software. You found the KaVo DIAGNoCam tooth on the screen of the computer. Then you need to add new patient. So you press the plus button and you write down patient ID, which is just a number for the patient. First name, last name. You can add birthday. Usually I don't change the birthday date as it's not that much problematic. Patient ID, or it could be date, will change everything. Then we press the patient name and we press the button with the DiagnoCam on it. We will go to another screen or another part of the application for the DiagnoCam scanning. There, what we can see? We can see the large screen that is now inactive. That's where the DiagnoCam we can observe. On the lower part of the screen, we can see multi-shot or single-shot option. Multi-shot means that when we will press the image button, we'll get 3 shots or all the shots that are possible to make. And if it's single shot, we'll get only the shot that we are currently observing with this kind of device, whether it be transillumination, intraocular, or fluorescent. Usually I tend to leave it at multi-shot, as the multi-shot, I just get more information out of it. Then we have the transillumination, intraocular, or fluorescence. So this is, it can be set with what kind of image we will start our examination. For caries diagnosis, I always start with trans illumination, which is quite obvious. Then we can observe the patient's teeth diagram, where we can change with the use of the some mouse device or with the use of DiagnoCam the numbers of teeth that we would like our image to be written to. So here we can get a diagram for the adult or children patient. And that's are the most important parts from this site. Okay, so this is how we do it. And then the operation of the DiagnoCam. So here you can see like the large screen where you can see the actual device on the holder, and in the left lower corner you can see the screen of the computer in the same time. It's a bit small, but all can be seen. The DiagnoCam device activates when we will lift it from the holder automatically. You can see the camera is working now. Yeah, that's Dr. Mikolajczyk there. Also, you can see that the camera actually has an autofocus mode, so it's focusing all the time to the picture. We can, by pressing this button, change which image we will start the work with. Don't worry about the intraoral image. It's not problematic. It's a little blurred now because it's focused on the plastic sheath. Then it will focus on the tooth. It won't be visible. With those 2 arrows, you change the number of tooth on the tooth diagram. So you can see how it is changed. Each press means one tooth change. And the screen with the triangle is for taking images. We have a multi-shot mode. With transillumination, we get 3 different images. The same set of the tips, the same set of the buttons is on the other side of the device. Sometimes it is more useful to work with the other side, especially in the lower or upper region accordingly. So this is how the DiagnoCam actually is operated. Also, one more thing, you can remove the transillumination. The DiagnoCam will then automatically go into intraoral camera mode. You don't need to change it, you don't need to press it. This is important because when I use it as an intraoral camera, it is better not to have those 2 points from transillumination tip. Here we get only 2 pictures because, of course, transillumination does not work. Whenever we will put the tip again, it will work again with transillumination, and we will get like 3 different images. As I said, don't worry about the plastic sheet. You will see it's not problematic when we work with the patient. Right now the camera is focused on it. It won't be during our work. So this is the hold of the device, and this is how I work with my dental patient. So we put the device in a way that the optics will surround the alveolar bone. Then we can see the tooth clearly in our camera. We can maneuver the tip, move it a little bit to get as good result as it is possible, to go through the teeth and observe all of the teeth. So the most important part for transillumination is to look for class 2 devices, but that's not all, of course. So whenever I want to make a picture of a tooth, then I go to a specific tooth number on the diagram, and then I press the play button, let's say, to make an image. So the idea is to first quickly scan the whole quadrant, find the tooth in question, and make images just of that tooth in question by assigning them to a typical tooth inside on the diagram. And here again, we can observe the teeth in transillumination mode. Now I go through the diagram when I work with myself. The same can be done by the hygienist or by the dental assistant with the use of the mouse, of course, on the screen. Then I press the button and I get the image of the tooth visible. Okay. So whenever I want to use the device as an intraoral camera mode, usually I tend to just remove the transillumination tip and then I use it in such a manner. As you can see, then the camera is focusing on the teeth and the image is actually very good quality. Also, the images taken with DiagnoCam, if you need to export them somewhere else, also are very good quality and quite a large images with a lot of data inside. So this is something that I also do like. So this is how I would work with DiagnoCam in an intraoral camera mode. to make a picture of the tooth, like right now, 2.7. Okay, again, press the play button, and this time we will just get only 2 images of the tooth, not 3, because the transillumination device, of course, is not working. Okay, so now you know the basics. Let's think of the clinical use for the DiagnoCam. So the DiagnoCam examination can work like this. We put it in the mouth of our patient. We scan through all the teeth. We find the teeth in question, and then we make images. When we make images, we must remember to hold the tip still for a moment, because it's not just one image, only 3 images. So we shouldn't like swipe it all the time, because then the third image probably will be misplaced a little bit. So we need to hold it for a moment in order to make an image. As you can see, the work is quite easy in the patient's mouth. It's not problematic even for children patients, as in this case. What we can observe during such an examination on the screen. So this is also quite typical. On the screen, we see the same, only in slightly different position. So we find the tooth, then we make pictures. It's good if the teeth are dry. Here you can see why, because otherwise you will get some images of the saliva bubbles inside the tooth. The teeth don't need to be cleaned thoroughly before the examination. For the transillumination, it actually doesn't matter if there is some plaque or not. It matters more for fluorescence tip, because then it will show how it works. So I position the tip, then I make some images of the teeth. And I get like 3 different images. Okay, this is another quadrant. And one again, we can position the tip and do images. During when I try to position it, as you can see, we can move it a little bit to the side to get the best image that is possible. This is very convenient regarding the trans illumination tip. Okay. So if we move it a little bit to the side, sometimes we get a better view, especially in case of class 2 cavities. Okay, so these are again from the exact same video that we tend to see just before, and like we are taking images out of it. Okay, so what do we see? We see teeth. We see teeth with some changes. So this is the first image for the patient, normal image. Then we see the image with transillumination mode. And we can see if and where is there a problem by seeing the differences in the darkness of the tissue. So we see the enamel that is lighter, dentin that is slightly darker, and changes in the enamel that could be demineralization or deeper caries inside the fissures. How it will be explained in a moment. We can observe also fillings from different materials, which will look differently in trans-illumination mode, of course, or in laser mode, so to say. And we can observe, like in this case, fissure sealant, some fissure sealants and some materials, for instance, glass ionomer cements or all metallic materials are not transparent for trans illumination. So we won't see what's beneath such a material, but we can check the boundaries of the material and dental tissue. Are they clean? And if the quality of the fissure sealant in this case is good or not. What we can detect with DiagnoCam device, mostly about caries. We can detect occlusal surface caries, and this is a very typical case. The occlusal caries will be like black spots. You will observe a very black, very dark spots inside the fissures. Then we know that the caries is deep in the dentin. You will also observe light gray, but still darker than dentin changes that says that it's just demineralization of the tissue. Like here you can observe demineralization around the deep opening of the caries. Most useful device for me is for interproximal surface caries, where we can detect the caries that is not visible otherwise, sometimes even not on an X-ray. So this will be all the cases of interdental caries, proximal space caries that are not to be seen otherwise. Also, we can detect leakage around fillings, no matter what the filling, from what material the filling is. If it's composite, also we can detect caries underneath the filling as well. So this is, I think, quite obvious. Secondary caries next to the filling. This is how the amalgam filling looks like. So again, it's completely black, but we can detect caries and a deep one around such a filling. Secondary caries under the filling. This is sometimes a bit tricky because of glass ionomer cement that can be also sometimes as a sort of lining under the filling. And to some extent, we can check the prosthetic work, if it's done from ceramics or if it's done from composite material. Like in this case, you can observe a crown, and this crown is built up on the core that is made from fiberglass posts. That's why we see those beautiful two very light lines where fiberglass post is transmitting the light very much. So by thinking of the class 2 cavities, the most important ones to detect, we can observe a healthy tissue. We can observe enamel demineralization, as is seen on the left part of the screen. It's usually in sort of a triangle without contact with the dentin. That we observe the deep demineralization in the enamel. Again, it is important to see it that it's only in the enamel without any contact with the dentinal tissue. Whenever you will observe, like in this case, contact with dentinal tissue, then be sure it is actually deep cavity in the dentin. The dentin is already changed. No doubt about it. Even if you don't see anything with your eyes, even with magnification, sometimes I don't see under the microscope even. Believe me, it is still there. And also this is what tells us about our treatment plan. Healthy means healthy. With the superficial enamel changes, hygiene measures, dental flossing, water injection, maybe fluoride remineralization, control every 6 months is enough. If we get the deeper enamel demineralization, we need to act a little bit more. Of course, hygiene is the same. Remineralization also is important. Maybe peptide regeneration that is getting more and more popular now. Maybe infiltration with a special resin as well. This is the moment for it. Also, control now is required more often because we need to observe if the cavity is stopped or healed, or is it progressing. With DiagnoCam, since it's just a laser, non-invasive device, we can do as many images and as many examinations as we need, no matter what time is between those examinations. And when we observe like a large cavity, drilling, intervention, and filling will be needed. So how to work it clinically? This is a typical case for DiagnoCam. Would you suspect something? Maybe you would seeing the large tooth on the screen, but seeing the small tooth in the patient mouth, probably you would say it's perfectly healthy. And it was also something for me at the beginning of the work with DiagnoCam. Then we take the transillumination image, we see a large cavity. At the beginning, I was not always a believer, so I took a very small drill just to slightly open it and make sure. After a couple of cases where after DiagnoCam there always was a caries, and usually quite large, I tend just to drill whenever I see a problem on DiagnoCam. In this case, I also took an X-ray. X-ray was not visible. Well, maybe a little bit, but certainly not to this extent. We open it, we see a typical case for the caries. We clean it completely and we fill it. This is how it works with DiagnoCam. So from the tooth that looks quite okay, and remember that also for the patient, this tooth looks quite okay. Even if we show him the image with the intraoral camera, it looks okay. There is no caries. And yet there is, and we know how to find it. Another case, maybe more obvious, again, if the tooth is large. So this is actually quite a large cavity, a little bit visible, also opened, also with a typical, almost from the book, look of the carious tissue, cleaned and filled. This is another case, even better documented. I like it a lot because really there is no sign of the caries. When I took the examination with DiagnoCam, I noticed a change in the enamel, and I know it is a caries already in contact with dentin. So the drilling started. As you can see, we drilled the tooth that looks really, really nice. So we open it, and right after we open it, we see that there is demineralization of enamel underneath. This is something we see very often, and the caries inside. So this is how it looks, just the demineralization. Then we drilled a bit more, and in a moment we get just to the caries. And look, this is actual, real, quite deep caries. It's a premolar tooth, so such caries already is problematic for some possible proximity to the pulp, because premolars are very narrow teeth. So we open it, we drill it more and more as we need to. Yes, with the picture taken, we see the dark caries inside in a tooth that it was not visible at all at the beginning. This is the strength of the DiagnoCam. And this is why we can work with such an ease with our patient and caries diagnosis. And this is drilling and filling. For class 1 cavities, the DiagnoCam will work as well in a perfect condition. Is this a tooth with problem? Maybe it is, maybe it is not. The patient was experiencing some pain, very mild and not very often, but she felt it a little bit, so we tend to look and look. And with the DiagnoCam, we found a very actually small, not quite visible cavity. Look here. This is like the entrance here, a very, very small one. And demineralization around here. Well, not so small, actually. So this is very often, especially nowadays, a lot of fluoride intake, quite good hygiene, small damage in the enamel, and more and bigger caries in the dentin. So this was opened with a drill. The opening was very small, but actually it occurred that the enamel is already damaged inside, as you can see. So then it was completely drilled and filled without touching the part. So whenever you see a dark or black spot somewhere in the fissure, be sure there is caries underneath. Another case, the typical one, like when we are wondering what to do. Can we fissure seal or not? And which actually of those fissures are problematic, which are not. So we do the DiagnoCam Vision, and we can see a very typical actually image. Light gray changes somewhere in the fissures that are just superficial demineralization, not requiring drilling. We see then light gray changes, again, superficial demineralization, getting deeper and deeper inside. So these dark spots, almost black spots, are actually for the caries changes that are touching the dentin. As you can see, it can be easy visible. That's why those spots were open and those were left untouched, because there was no need for intervention. Again, you will start to work minimal invasive and very precisely where you should work with the drill, where not. So this is like a whole summary of this part, a clinical procedure for clinical use of DiagnoCam. If at any time during the presentation you are taking some pictures, which I am happy for, because then I know it's useful for you, this is the good moment to take the image of that slide, because this is like the whole clinical procedure for DiagnoCam and for the perfect work with DiagnoCam. Okay, if you need it, we can come to it at the end. But that's not all. Yes, this is the clinical perfection. We need to make the patient happy, so we need to prepare everything around DiagnoCam. And these are 2 short videos with sound that I prepared from my dental office. Please listen to it carefully. So this is me in my dental waiting room. So the science research says that dental examination is important in 2 parts. One is clinical excellence, and another one are the feelings of the patient that he is treated in a good way. And some of the research says that it's 50-50, 50% clinical perfection, 50% our ability as dentists to please our patient with the treatment. I think it's more. 30% is clinical perfection, 70% is what is going on in patient's head during and after treatment, how he is informed, how he is pleased with the treatment, how we will see it. And I believe it. And on this belief, I built up my whole dental clinic. DiagnoCam actually was the device that helped me a lot of to build up this feeling. And let me show you how I make it with my own dental office. So this is like my dental office, my throne room, where everything is organized as it should be for the show for the patient, to tell patient the story, to inform him and to please him with the outcome of dental treatment. So it is very important to present the patient in a good way, the diagnosis and then outcome of the treatment. So I invite the patient to my dental office. It's always me, never dental assistant. I never allow my patient at the beginning to sit at the desk. This is just my way of doing. Instead, I ask the patient to sit on the dental chair. I believe this is something that builds up the feeling in the patient that, well, he's the patient and I'm the king here. So he should listen to me. We are not equal in this room, right? So this is the central point of the dental office for the patient. DiagnoCam Vision is handy, so I will use it as a first device for the diagnosis, and it will be always used at such visit. But the most important device that you can see in my dental office is as large as possible TV screen. This one is 55 inches, normal TV, built up on the wall like 2 meters from the patient's side. And actually, when I was organizing this room, the first thing I know is where the TV will be placed. Only then how to place the dental chair so the TV will be seen by the patient. And this is like the central device for the patient. From this point where I can show the patient everything on a large screen, I can explain everything. I use it for DiagnoCam images, for some tomography or CBCT images explaining, and on and on. This is for the patient, but also for me. So this is like built up around this. Look at your dental office. If it's only possible, find the place for as large screen as it is actually possible. Okay, so lip syncing wasn't that bad. How to introduce DiagnoCam to your patient? One more time, lip syncing at the same day. I am doing it anyway all the time, so not a problem. So this is how the patient is seated, and this is how I start the diagnostic examination with the patient. So I say that today it will be just examination visit. It will be completely painless and not problematic. I will always start with 3 questions. One is, do you feel any pain with the teeth? Do you see any bleeding from the gingiva? Usually patient nods no. And third question, do you have any problem with food particles stacking between the teeth? Very often patient nods. This is how we start to look for some problems in interproximal region. Now we will use the laser device to see if there are any problems with the teeth. The examination will be completely painless. I will use just a mirror and a special laser device. A laser is very weak, so it's completely save. Afterwards, we will see some images which will look like an X-rays, but it has nothing to do with röntgens. There is no radiation. It is completely safe. Don't worry. So then we will discuss the outcome and see what is going on. So we will start. For the children patient, I tend to examine them like seated, like here. For the adult patient, I will examine them lying flat on the screen. Okay, now no sound, just my comment. Again, we will go through. This time, you see small device and large screen. This is what I see on my large TV screen. Whenever you put it out, it's on. When you put it again, as you can see here, I use it with my dental chair. If it's KaVo chair, then it's possible. This is our patient for today. It's a very good cooperative patient, so don't worry, we can work with him in the same manner as we did in a moment before. So this is a sort of revision. So I start with checking the camera, then I scan in a quick manner through the whole quadrant, look through all the teeth. It works best on the premolar and molar teeth, but you can scan the front teeth as well, of course. So first I scan all of them, then I come back to the teeth that are in question and that I would like to take an image of. With the arrow buttons, I mark the tooth and then I position DiagnoCam to make an image. So this is how it works clinically. And actually, yeah, it's more 2.5 than 2.4. My mistake, sorry. Okay, so I get like 3 images at the same time. Then I press the play button to again turn on camera. And I think, should I make other? Okay, so this is the revision. We normally work it like this. How to explain DiagnoCam image? Then the adult patient is seated and together we go through the image where I explain what is light, where is the enamel, where is dentin, where is caries, what are all the changes. I'll allow my patients to ask, what is this, what is this? This is how it works for me when we are looking through the images together with a patient. So as you can see, it works quite well. Also, the patient can see everything. Working with the software, you just point on an image that interests you, you double click it, and then you can see the image. If you press the mouse button and move up, you will get the image darker. Move down, the image will be lighter. Usually I tend to get it a bit darker. If you press the mouse button, make it to the right, you will get more contrast. Make it to the left, you will get less contrast. Then you can close the image, open another one. So these are key sentences for the patients that I use during this part of the examination. Everything that is black is problematic. Imagine that you look at the tooth from the up in vertical position to position the tooth with the patient. So this is for the transillumination mode. For the fluorescence mode, All that is light green means it's filling material, because most of the composites has some fluorescence. All that is light red is calculus and bacteria in fluorescence. We'll see it in a moment as well. Okay, so, well, right now, yeah, it's more than an hour, but I hope we still have some time. We are closer and closer to the end. Some tips how to work easier with DiagnoCam. This is something you won't find in the instructions. Probably, maybe it's also not proposed by the manufacturer, but this is something that I found useful for my work. So, first of all, you need to operate software very easily near your dental chair. The best solution that actually I'm doing right now is a trackball device. So this is like a mouth lying on the head, not a typical mouse, because for the mouse you need a lot of space near the dental chair. It's a trackball where you just move only this one. It's very easy. Only one company now is producing them, Logitech. So this is very useful for any software navigation on the screen. If you have dental KaVo unit, put the DiagnoCam on the dental unit, especially on assistance part, on assistance table. It is working well, very useful with work. If not, then use the holder. But again, think if you can maybe glue or mount somehow the holder on the dental unit. Children patient will be afraid of the DiagnoCam. This is how to prove the DiagnoCam is painless. You take your finger, you press it, and you show it on your finger, or even better, on your, as in this case, on your patient's finger. That it is, if it's not painful on the finger, surely it won't be painful on the tooth. Works perfectly every time. If you want to fast change only to camera mode without transillumination, just remove the transillumination tip. You get the camera. Put on transillumination tip again, you get the full DiagnoCam device. For the patients with some prosthetic works, especially on metal base, you won't use transillumination anyway, but you can use the camera. Adjust screen look. This also you can take an image of this screen. Okay, so in this part of the screen, there is a settings button. If you press it, you get this small screen. Here, you should check this box, show live image after image capturing. Then the DiagnoCam will automatically switch to live image after you capture. You don't need to press with finger one more time. Then you have configure image presentation, where you can regulate the camera a little bit. I like my image to be a little bit more brighter and more contrast and enhanced than normal. So these are my settings visible here. You can change it, see how it affects the image. If you don't like it, just press this button here, which says the starting settings, and you get to the beginning point. But feel free to maneuver it a little bit, see maybe your screen requires a little bit different image. Also, maybe from time to time, or for some presentation needs, like here, you will need a video out of your DiagnoCam examination. It is not possible inside the software. You can use either some software for the gamers. I use this one, OBS Studio. I don't play any computer games, but I know they are using it to just record the screen of the computer, or you can use the combination of the buttons from the computer. You see Alt, Windows, R. Then you will get a small window, and in Windows 10 or Windows 11, the screen is constantly recorded from this moment. So actually you can get a record of the DiagnoCam as well if you need it. Okay, so we focus mainly on caries diagnosis, but this is not the only thing actually you can use DiagnoCam for. There are some solutions that I found. Maybe you will find some more, who knows. First of all, calculus. It is there, it is very often with our patients. Usually it is visible in a very good way, even with the oral camera mode, as in this case. But remember, fluorescence is giving you even more boost for the calculus, so it is visible much more and much better. Also, it is visible in a places where maybe you or the patient wouldn't be sure that the calculus is there. Like in this case, it is visible, of course, in the front teeth, but look how much of the calculus and plaque is actually also on the side teeth, near the gingiva. All of this also must be removed and is not visible that easy, especially for the patient, on the oral camera mode. Okay, also we can control after all, just to document for our patient after the removal that we done a good job. Okay, with DiagnoCam we can also see what kind of the filling is inside the tooth. Composite is a little bit different in illumination than healthy tissues, and the same goes for glass ionomer. And glass ionomer is like a much darker spot. So for this, we need to control it with the intraoral camera, confront it, see the filling, and then on the transillumination mode, if we see that it's much darker than the composite, then we know it's glass ionomer. Okay, we can make, as we discussed before, some control of prosthetic works, like in this case an overlay only made from the composite or ceramics. We can control composite fillings and see if there is some problem underneath, especially in class 2, where it will be also visible. It can be problematic when the filling is very thick, like more than 4 millimeters, or we should also remember that sometimes we can get the glass ionomer lining under the filling, but it looks, of course, different than caries. We can document that we done some fillings as well, like not one, but two, like in this case where we have actually two caries nearing the teeth. So we start to open one of the caries. When we opened one, we control it. This way we won't see any problems, but we see what we saw on DiagnoCam image as well. The second cavity that is already opened, it's already cavitated in the adjacent tooth. So both these teeth need drilling and filling. Both of them look quite all right at the beginning. So then we make two fillings instead of one, sometimes changing the decision during the work, and we can present it to the patient on the fluorescence mode as a two good looking fillings. Of course, our work with intraoral camera is those fillings not to be seen. With DiagnoCam, also not to be seen that there is any border. But with fluorescence, we can always see our fillings. Also, from time to time, it is easier to find the canal entrance. It's not working always, but it helps. Try it. you don't see anything, also in fluorescence mode, but with DiagnoCam transillumination mode, sometimes you see more light coming through the canal, opened canal, than through the rest of the tooth. Also very good for documentation and finding. Quite often, unfortunately, lately, vertical cracking of a root. So sometimes we have, if we use dental microscope, of course, we tend to see it, but our patients don't see it. And also very often we are not sure if there is a crack in the root or not. How deep is the crack? How problematic is it? Is the tooth to be removed or not? Like in this case, I saw it with the dental microscope, and I was wondering how to explain it to the patient that the tooth that wasn't that bad sometimes suddenly must be removed. So the intraoral camera is not helpful. Fluorescence also is not helpful, but transillumination mode actually can show a perfect crack inside the root. So this is also some additional ways I found with DiagnoCam. So with DiagnoCam, we have images for the patient, documentation for us. It's very good and safe for children. You don't need to ask the parents to go out of the dental office. For some pregnant patients as well, you can control them all the time you need. No problems at all. It's painless, fast, non-invasive. You can repeat it every visit if you like, or if you need. But the most important thing with DiagnoCam for me is the safety and my patient also, like inner security, inner safety. I know as a dentist, when I scan through all the teeth for my patient with DiagnoCam and I don't see any caries, I know that all the teeth are caries free. I am never that sure when I do just optical examination. I am never that sure when I check the pantomogram, but with DiagnoCam, I can be sure. And also when I find the cavity, even if it's not visible with my own eyes, I know it is there and I should treat it. So we had the procedure for the clinical use. Now we have the procedure for the whole dental visit plan with DiagnoCam, as it's a little bit different. So again, please make a picture of the screen if it's possible or if it's needed. This is how we have all. So we start with explaining the patient. This is also the summary of the presentation. We explain the patient how DiagnoCam works in easy phrases with magic word like laser device. Then we do the clinical procedure that we discussed before. After this, after the clinical procedure, we position the patient. We show him the large screen. We present the images of the tooth to the patient. First, normal image where the tooth looks healthy. Then transillumination where there is a caries. Then we open cavity with a drill. Then we make a shot after opening when there is visible caries dentin. Then we drill, fill, and we again present the images to the patient of this. So the whole secret is in the 10th point of this procedure. Present the story to the patient. All the dentists are excellent storytellers. That is what I can say from the workshops. Because we must speak to the patient. Usually it's a monologue all the time. So we are good at storytelling. So what is the story with DiagnoCam and with the whole treatment process? First, we don't see the caries, but it is somewhere in there. We need to look further. You don't see it, I don't see it, but it is somewhere in there. Bam! I have the device that is only in my dental office. It's a special laser device. Now we see the caries. I know, probably you don't see it with your eyes. Believe me, it is there. We started drilling. We opened the cavity to see the black carious dentin inside. Then, bam, intraoral camera picture. Look, there is a caries. It wasn't visible at first with an eye. Now it's clearly visible. This is the moment patient says, oh my God, what's this? So now we know it's okay. And then don't worry. I'm your savior. We clean it. You never take a picture of a cleaned cavity. Patients believe that cavity that is cleaned with the drill are white, which is not true. So, but let them believe it. Don't take only the picture of the filling after you make it. Best way before checking the occlusion, because then the filling is the most beautiful one. So look how wonderful it looks. And then we get the whole story. We couldn't see the caries. It was there we find it thanks to our special powers. Then we found it inside with the drill. We found how large it was, the cavity, and then we saved the day by filling the tooth. This is the story patients need to hear, not only for us to be clinically perfect, but also to please the patient, to make him, in his thoughts, in his head, a happy patient that is sure that is treated. What I noticed is that if you do this story once, then you get no asking from that patient, whatever your diagnosis and treatment plan for whatever treatment is needed will be, because you build up the trust in you and in your treatment. And this is what I would like to wish all of you. Have many happy and very happy patients. Good luck with the DiagnoCam working. Also, you can see my email right down beneath. So if you get any more questions or maybe some difficult cases, please feel free to contact me. Maybe I will not answer at once. Probably I won't. But be sure I will answer. Thank you very much. It's been a pleasure to make a presentation for you. It's been a little bit longer than I expect, but I hope it wasn't problematic. And please, let's open the discussion now. If there are any questions, feel free to ask them with your microphone or write them on your chat. Thank you very much.
Hello, thank you, Professor, for the doctor for the all the information. I want to ask about how it is helpful when we do root canal treatment. Is it only like showing cracks?
Yes, because the DiagnoCam is actually allowing us to see through the crown part of the tooth mostly. So in case of the root canal, we won't actually see that much. So I find it useful to find cracks somewhere in the root. Also to find sometimes canal entrances, and also from time to time it could be useful as well but for this you need like quite open root. When you look for the broken files inside the root canal, because with DiagnoCam beam, the transillumination beam, the tooth is enlightened from the alveolar bone. So the root actually will be very light because it's transmitting the light very well. There is not much tissue in there. So you can quite clearly see the inside of the root. And when there is like the cracked endodontic file, it's metal, so it will be black point inside the root canal. But like on a regular base, I don't find it very useful only in such certain cases when I need to look for something strange, right, in the canal. Another thing that I didn't discuss it here would be the fluorescent lamp to use to distinguish between composite material and tooth tissue or ceramics. It is sometimes useful after like veneer cementation when you look for the excessive cement that was left somewhere near the veneer, that it's also better visible with fluorescent lamp. So in my opinion, like the DiagnoCam, well, it is focused on caries, but it is a device that we can use for many more different solutions, which are actually continuously developed.
Thank you so much.
So maybe some clinical questions as well. I think that the cases will be built up all the time more and more, so it won't be also problematic for you. Like I said, when I started working with DiagnoCam, at the beginning I was using a very small bear just to check if the DiagnoCam was right, because especially in class 2, the tooth looks so nice, so beautifully, so I couldn't believe that there is a cavity inside. Now I know when I see it in DiagnoCam, it is there no matter what. Also remember, even if it is a class 2 cavity that you see with your own eyes, or you or me, I see with the intraoral camera, anyway, I do the whole 3 images with transillumination as well. So this is how I work, okay? And we have also the question, do you charge more for using DiagnoCam? Because I charge for X-rays, and if I won't use them anymore, I need to compensate this amount. Of course, this is why the explanation. Yes, that's why I say that we will do some images like with X-ray imaging, because it is normal, it is paid. So the visit with DiagnoCam is a diagnostic visit where we use special device that need to be paid. So of course we need to compensate. Also, X-ray is useful for checking the root status or periapical bone status. And for this, we won't use DiagnoCam, of course. But for the diagnostic visit with DiagnoCam, we need to charge, well, at least the same as for the series of bite wings or pantomography for the case of caries diagnostics. Actually, we should charge more because it is a much better solution. But yes, we should definitely charge. Anyway, we should charge. Okay, maybe some patients are also listening, but the patient is paying mostly for our time and our experience, and we need to present it to them. So yes, that's why I build up like the explanation where I compare it to the X-rays. So it's obvious then we do images like with an X-ray, we also pay for them. Maybe not for every image some amount of money. It's more like a complex procedure of caries diagnosis with laser device, but then it is paid, of course. And as I said, in my opinion, even more than with X-rays. Okay, but a very good question. This is something that, at least in Poland, dentists very often have some problem how to charge for diagnostic visits, or how to charge the patient when he says at the end of the visit, oh, doctor, maybe just look for, is there something else? Well, maybe there is, but the look means more time, more of experience, maybe some device using. So this is also the patient's head. Yes, I will pay when the dentist will use some device. So, okay, I am using some device. So definitely, yes. we should charge for DIAGNocam examination as well. Also, from one point, which I didn't discuss it here, it's a completely safe device. It can be used as well by dental assistants. It's easy to train, especially hygienists, to, let's say, make a hygienist visit, make a scaling and so much, and then do a quick scan with DIAGNocam. My hygienists don't afraid of the device because it's nothing, actually. It's completely safe. So they scan, and even they can like suggest the patient that he should go to the doctor because there is some caries. This is also a very good solution for me. Okay, very good. Good questions, actually. Even for me, even now, sometimes some ideas are just opening some doors to another ideas and another way of checking. So like this with DIAGNocam, one hand, caries diagnostics, on the other hand, also help in other ways and other solutions. I especially like the endo question because probably there is even some more ideas for it in the future as well. Okay, so we are good. Thank you so much. And also thank you so much. So now I will just leave. Thank you very much. Hopefully see you somewhere, maybe in flesh, in some dental conferences around Europe, or maybe also somewhere in the web. Thank you again and goodbye.